patient population here really appreciate what you're doing for them. We are the tertiary care facility. We take care of the most challenging patients, and when we put all of our effort into it, they see that, and they have a lot of respect for us as physicians as well as just people in general, and we're humbled by that, I think. So
there's a lot of variety in the program, but it's not so big that you don't get to know everything that's going on. So you get a lot of general surgery, but then you also get to do a lot of surgical oncology and robotic surgery, and you know the attendings, and they're very well trained and they're very helpful.
I've actually had a lot of time in the OR, and my chiefs are really good about walking me through cases. So that was kind of a pleasant surprise and a good motivator, because you do work long hours. Anywhere you go, you will, but it kind of keeps you going.
You've been exposed to the cases, you've been in them, you've seen them. So by the time you're a senior resident, you're able to actually kind of perfect your skills as a surgeon instead of just seeing the cases for the first time.
Having the opportunity to impact the training of the future generation of surgeons is a great responsibility, but also extremely rewarding.
It's a partnership with the residents to do the operations and do the patient care. And I hope residents with me sometimes get a real sense that their help was critical.
We have a strong commitment to patient care. And you can see that with all of the residents, you can see that with the faculty members, and we work as a team, and I like that.
Our residents pass their board exams, and they're very competitive for fellowships. Many programs now, when residents finish their training, they don't feel comfortable going into practice. They feel like they need more training. That's not the case here. If someone elected to go into general surgery, they would be able to do that.
With the growth of the program and the new robots we've got, we've actually been able to dedicate one XI robot just for simulation and training. And so that's a really unique opportunity for the residents to be able to get on the console, complete the curriculum on their own time.
The perfused cadaver program is awesome. We have cadavers that get hooked up to perfusion, so it's like that they actually have blood flow, so you can do surgeries on them like they're actual alive people.
The next week I'll get a text or an email. Hey, Dr. GRABO, thank you so much for the cadaver lab last week or the other day. Just last night I had a patient come in with a stab wound to the neck. That training stuck, and when they went to take care of a real patient, they understood, and that knowledge was cemented for them.
I really like outdoors. West Virginia in general is obviously great for that. You can do whitewater rafting, just hiking, running, rock climbing, anything you want. So I feel like there's a little bit of everything.
I think that a lot of people don't recognize the potential of coming to Morgantown. They view it as a small town with not a lot to do and not a lot of diversity, but I found that to be not true. There's literally events happening on Main Street, Morgantown every weekend, like the Chocolate Festival or whatever else you can think of.
There's enough stresses. Surgery is hard. Surgery training is hard. It's harder today than it was a generation ago. And adding more to it with a stressful environment is something that would just not be much fun for anybody. So fortunately, our culture, I think, takes some of that off.
We're taking care of very sick people, so we are serious, but when there's time to have some fun and be jovial, we do that.
I wanted a place where I felt like the residents were friends outside of work as well. And I feel like we are. We have events all the time where we hang out.
You feel comfortable as someone more junior going just up to a higher level person being like, hey, I really need help with this line, or I don't know what to do with this patient or what to do, and you know them, you trust them, they've been good to you and they'll help you.
As the program has grown, I've been exposed to, I don't want to say every pathology, but enough of pathology here in West Virginia that I feel comfortable going out and at least being able to take care of things that I'm going to see. And that's the goal of your general surgery residency.